Good morning. Welcome to the Doctors in Ask Dr. Arwady. It's Thursday, May 13th.
It is.
We're happy to be here with you where you can get the latest on COVID-19 and vaccine in Chicago. I'm Sybil Madison, your Deputy Mayor for Education and Human Services, here with Dr. Allison Arwady.
Good morning.
Your Commissioner for the Chicago Department of Public Health. We're going to check our distance and then we're going to get right into the data.
We are. So good morning. Actually, before we jump into the data, I want to just acknowledge, you might hear in my voice already that I have a cold. But
wait.
Yeah, right, here I am. So let's actually take this moment and talk about this. So I saw my family over Mother's Day. My mom was here, my sister was here, all the adults fully vaccinated, and some little kids around, including my very cute 3-year-old nephew who was quite having a cold, and I said, oh, you know, that looks potentially like something I might pick up, and I did in fact pick it up. However, reminder, I'm fully vaccinated against COVID. I was not worried about COVID per se, but nevertheless, I was developing cold-type symptoms, which I have not had in a year and a half, by the way, because of all the masking and hand washing and everything. And so a couple of nights ago, when it was really starting to come on, 10 o'clock at night, I said, let's see how quickly I can get a COVID test. Not because I'm the commissioner at the health department, but just like as a normal Chicago resident. And so I looked, and DoorDash had COVID tests available, $23.99 right here. I was able to get it through CVS, ordered it. It was to my door less than half an hour later. And,
wow.
And these are these rapid antigen self-tests now that are approved for use without a prescription, without a healthcare provider. And if you're not familiar with them, I thought I'd just bring it. You actually get 2 tests for $23.99. And they come with basically a swab that you put in your nose, not deep in your nose. You just put it in your nostril, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. And then there's a card, a pink card, and then there's a little dropper with some fluid. And so you drop the fluid on it, and then basically you stick the swab in the card, and then it comes out like a pregnancy test, like a line. And so it'll show you if you're positive. Did it immediately. So I thought to myself, I should take a COVID test because I have symptoms. Even though I'm fully vaccinated, I want to be careful. At my door, less than half an hour later, results 15 minutes later after that. So like it was great because when I think about the difference between, you know, how hard it was to get a test a year ago.
Right. Remember when,
and it was multiple days, and you know, I certainly have paid a lot of attention, and I knew these were available, right? These are available.
You've been talking about them.
I have been talking about them. They're not the only ones. There's other companies too, but they're available. You can get them at CVS, Walgreens, Walmart. You can walk in at a store. You can order them online, or at least here in Chicago, I could get it even on something like DoorDash. So didn't even have to leave my home. So anyway, just a nice personal example of progress in COVID testing, and I just wanted you to know, if you hear in my voice, I have done the things that I would want you to do. Even if you're fully vaccinated and you're getting new symptoms, we still have a lot of COVID around, and we want to make sure people are not having a breakthrough infection.
Yeah, and just to unpack that a little bit, what if that happened and you couldn't get the test right away? What would you have been expected to do?
Yeah, so
by the commissioner of the public health
by
department?
myself. Yeah, the very first order that we put in place here in Chicago, even before the stay-at-home orders, the very first one, the first emergency order, is the one that basically says stay home if you're sick, even sort of a little bit sick. You've got new symptoms coming on, and you haven't been diagnosed. You need to stay home basically, you know, until you're cleared. So that does remain in place, and I just want to remind people that we're still doing actually a very good job of testing here in Chicago. There's more than 12,000 formal COVID tests happening every day, not even counting about some of these home self-tests that people are doing, and that those rates have stayed up, which is part of why our positivity looks good. But yeah, we really, you know, as people are returning to work, obviously in indoor settings here, we're still recommending masks when you're in common spaces and whatnot. But it is also, we've been talking even just with my own staff at CDPH about, first and foremost, get vaccinated, of course. That's the most important thing. And if you're in a highly vaccinated setting, the risk is very, very small. But also, if symptoms are coming, we are still encouraging people to get that COVID test.
All right.
All right, so look, some data real quick. So,
Yeah, I forgot to
yeah.
remind people, hashtag Ask Dr. Arwady with any questions on Twitter or Facebook.
Yes, and I'm on Twitter now. Did
Oh,
you
that's
know?
right.
I told them on Tuesday. It's brand new,
That's
so
right.
people have been. It's at Dr. Arwady. So we've been getting more questions and things through that route as well. So joining this century. So we'll look at our data. CHI.gov/COVID- as always, and look how good this data looks. If you follow along closely, and I know a lot of the people who watch this show follow closely, two big benchmarks that we passed last night. We're back to a 3.9% positivity, so under 4%. You see a week ago we were at 4.5%, really nice improvement there. The testing, like I said, is doing about 12,000. And then look, 398 new tests per day. Why am I excited about 398? Do you know?
Because we're 2 under 400.
We're 2 under 400, exactly. That 400 case per day mark, that is our benchmark, and it has been since the beginning. It's the equivalent of 15 cases per 100,000 per day, and it's where we move from high risk to moderate risk. So we've just moved into that territory. We really want to be under 400. Ideally, we want that number under 200, but this is really nice progress, and it's been since the middle of March that we were there. So it's good to see this. Yeah. What are you laughing at?
No, okay. I don't know why I never expect the pop quiz.
Well, I mean, I know you know.
You always still get me.
I know you know. I try. I wouldn't give you a pop quiz answer. I didn't think you know the answer. I mean, you know this stuff as well as I do at this point. I want to just show you a little bit of other data. We were getting a lot of questions in just about sort of how does this fit into numbers and hospitalizations. And so I'm going to just pull up a quick set of slides. All of this is publicly available on the dashboard, but it's just a quicker way to look through it. So first of all, sorry. For some reason, I am trying to, there we go, slideshow. Okay. Okay, so hopefully that's big and you can see it. So you can see with that 398 cases per day, we are now in moderate or lower risk for the main categories that we're following here. So moderate risk for cases per day, lower risk for test positivity. We're still at moderate risk for our hospital beds and our ICU beds, but those have stabilized and we're not seeing increases there. So that's all really very promising in terms of the main metrics. Also just high level for vaccination. 47% of all Chicagoans have gotten a first dose of vaccine. That's all ages. But to break that down by race ethnicity, about 54% of white Chicagoans have gotten a first dose, about 53% of Asian Chicagoans, about 38% of Latinx Chicagoans, about 31% of Black Chicagoans. So we have a long way to go. And certainly we continue, heavily Latinx communities, heavily Black communities have been the hardest hit by COVID all along. And CDPH and really the whole city are having a lot of focus on trying to make sure we can get vaccine easily accessible in the neighborhoods that have been hardest hit so that we're all protected across Chicago. If we limit it to people who are 18 plus, 59% now of Chicagoans have gotten a first dose of vaccine. That is right in line with the national average, and that national goal is to try to get to 70% of adults with at least a first dose by the 4th of July. I think we can do it. It's going to be a little bit of a stretch, but we're at 59% today, and we're really hoping to get to 70% there. And then 68% of Chicagoans over 65 have gotten a first dose. This is just what our graph looks like overall of cases. Cases are continuing to decline, but I want to be clear, we are still seeing COVID cases every day in every neighborhood across Chicago. It doesn't matter where you live, there are COVID cases still emerging from there. It's still a very generalized outbreak. Most COVID cases are still in younger adults. You can look in detail online, but those top lines here are people actually in their 30s, their 40s, and their 20s are where we're seeing the most cases. Highest rate still in Black Chicagoans in that purple line there. The blue line is Latinx Chicagoans, green is Asian, and red is white Chicagoans. And some of that is because we're seeing the lower vaccination rates. Like it really does track along with that.
Yeah.
And if we look over the last month or so, this is how you can see really on a daily basis what the cases look like. And so first you can see those cases overall are going down, but also sort of over the last month alone, just here in Chicago, almost 5,000 cases in Black Chicagoans, more than 3,000 in Latinx Chicagoans, more than 2,000 in white Chicagoans, and almost 500 in Asian Chicagoans. And then when we look at the severe outcomes too, I think people have this sense that COVID's over, and unfortunately COVID is really not over. And so this is the same thing. This is the last month, and it just shows you by a count per day how many deaths we had just of Chicago residents. And so April 12th to May 12th, again, broken down by race ethnicity, there were 78 deaths in Black Chicagoans, 40 in Latinx, 31 in white, and 6 in Asian Chicagoans. We're averaging about 6 deaths a day. But oldest people are still at the highest risk for these severe outcomes. And that's why, you know, the vaccine number that worries me the most is that 68% of those over 65. It's not high enough. We really, I want that number over 80% if we can possibly get there. Because you see, in the last month alone, again, April 12th to May 12th, just here in Chicago, we had 16 people die of COVID who were 18 to 49. We had 68 people die of COVID who were 50 to 69, and we had 76 people die of COVID who were age 70 or over. And so the vaccine has made amazing progress, right? Like we're not seeing the huge numbers like we were, particularly in some of the nursing homes and the highest risk settings. But still, if you know somebody who's older and not yet vaccinated, please reach out, because many of these deaths increasingly are more preventable with vaccine. This is just the high-level overview of vaccination rates by zip code. So you can see on the left, this is our at least 1 dose by zip, and then on the right is completed vaccination by zip. You can see the maps look very similar. The lightest blue areas, so you can see straight west, and then especially on the south, is where, you know, between a quarter and a little more than a third of people have gotten a first dose of vaccine. Most of the city, around 40 to 55% have gotten a first dose, and then in the darkest blue, especially on the north side, between 57 and about 77% have gotten a first dose. So, you know, as we've seen throughout the pandemic, people with more resources, more ability to prioritize vaccination, perhaps more confidence in vaccine overall, are where we're seeing the highest rates. And so our goal is to really turn this whole map dark blue.
That's right.
And it's really clear if you look, we're just about through the slides here, but on the left side, this is where we were seeing the most new COVID diagnoses in our most recent week. Again, the dark blue you see on the far south side is where the most new COVID diagnoses came, but they came across every single community area had at least one case. And then if you compare that on the right, you can see those same areas that are darkest blue in terms of cases are the lightest in terms of vaccination coverage, because unfortunately we're seeing COVID more and more concentrate in the parts of the city that are least coverage. And even at the census tract area, you can see, like in the Pilsen area here, on the left, that's cases, and it's very, you know, the light in color, very low number of cases, and some of that is because there's very high rates of vaccination. We're making good progress on Protect Chicago Homebound. We're at almost 1,000 homes. Wow. That we visited, more than 1,500 vaccines administered. Really, if you know anyone who has difficulty leaving their home, please call 312-746-4835. We want to send folks out. We want to get these most vulnerable folks vaccinated. The United Center's going strong. We're doing about 3,000 a day at this point. Most of those are second doses, but we've done 263,000 vaccines, and I love this, 46,000 translation services offered. People who are coming in, English isn't their first language there, did a lot to really make sure we work on that accessibility. And we were adding up the other day how many targeted like vaccination events we've done across Chicago. There have been more than 1,000 where we're going to employers, going to senior centers, going to shelters, you know, going out for neighborhood-based events. Like, it's been a real all hands on deck. Did want to announce that on the next 3 Saturdays, so starting this Saturday and then the next 2 Saturdays, CDPH in partnership with Chicago Public Schools and Chicago Teachers Union are bringing COVID-19 vaccines to 15 schools. So with our bus, you you can see which schools for May 15, May 22, and then May 29 will be there 10 to noon. And it's not just for kids, right? We've got the Pfizer available. That's for anybody 12 and up, now that that's been given the authorization. And J&J is also available for 18 and up if there are adults who want to get the one and done vaccine.
Make it a family affair.
Make it a family affair. Parents or guardians have to accompany youths, actually, but we want anyone to come out. Just as a reminder, there is COVID funeral assistance for anyone in Chicago who had COVID-19 related funeral expenses going all the way back to the beginning of the pandemic. Get up to $9,000 reimbursed per COVID-19 death. So there's information online about how to get that information. If you know someone, or if someone in your family, you had a loss from COVID-19, this is a FEMA program. The federal government is actually reimbursing costs for that. And so, it's sad to share that news, but we do want to make sure people have it. And then we announced the Vaccine Ambassador Program earlier this week. So with City Colleges of Chicago, this is the website, ccc.edu/vaccine ambassador. You can go there. It is a course. It is available online. It takes about 2 hours. It is not designed for medical professionals, but it was designed here in Chicago to give some background about COVID, answer some questions, and then give some tips about how to talk to your friends and family about the COVID vaccine. We're using it internally, but the City Colleges made it open to everybody. There were a number of partners involved. Would love to see people take that course, give us feedback about it. And after people take the course, they're actually enrolled in sort of a community of people who are interested in this, and there could be opportunities for volunteering or being part of groups that are doing this later. And then finally, just a last reminder, as of today, kids 12 plus. There are appointments available right now. You can go to zocdoc.com/vaccine. You can also call the call center, 312-746-4835, or you can walk up at any of the City of Chicago sites. And it's been great to see already this morning lots of kids getting vaccinated. All right, that was a lot of data, but I wanted to get through it all.
Great.
Thank you.
All right, and just want to lift up, Dr. Arwady, that when we look at vaccine equity here in Chicago compared to other large cities, we're doing really, really well.
We are.
But like you said, we've got to do even better in terms of just getting more coverage.
Yeah, and the thing is, we've been tracking obviously very closely. Every week, our epidemiologists look at the largest cities across the U.S. And at least at the end of last week, as has been consistent for the last few weeks, Chicago was first in terms of that first dose coverage overall, and we were also actually first for especially Latinx coverage. We've gotten a lot of folks who have Latinx ethnicity vaccinated. That 38%, it's not where I want it to be, but it's very good compared to a lot of other cities. And I really want to give a shout out to all of the community-based organization and clinical providers who have been helping with that. And actually, even the Black coverage at 31% was also, at least at the end of last week, the highest across the largest cities, which tells you how far we have to go as a country, realistically, where we think about the barriers there. So, on the one hand, we're glad to be leading in that equity space, but we are a very long way from done. And more, 56% of our first doses last week did go to Black and Latinx Chicagoans. So we continue to hit that goal of getting the majority of doses, but there's a long way to go.
Yeah. All right, let's get to your questions. Yep. Here we go. At VaxPMO from Twitter. How many doses is the VaxBus administering per day right now?
Sure. So it really depends on the site that we're at and how much interest we have. We typically bring out maybe 100 to maybe 200 doses. We have ways to keep all of the vaccine cold, of course, even on that bus. So whatever we don't use, we're able to transfer out. If we were to see a very lot of people come, we could bring more vaccine out. But generally, I was out at one of the VaxBus events in Austin on Saturday, and they did about 50 people just from a sort of small block radius. That's a very successful VaxBus event for us because this is not hundreds of people vaccinating. We had 4 nurses on the bus, and typically when the Vax bus parks somewhere, it's there for maybe 2 hours, and then it goes somewhere else for 2 hours, and there's the ability to kind of move around. So it really depends on the day, but it is, it's typically a double-digit to maybe a low triple-digit number of doses, but it's a good, efficient way of getting folks vaccinated, and we're interested, like at the schools this weekend. We'll be ready if there is more. We have the ability, in addition to vaccinating on the bus, we can sort of set up if we need to, if there's a lot of interest, vaccine sites even off of the bus. But yeah, we're ready sort of for whoever comes.
Yep. The bus is a big hit.
It is a big hit.
Colleen Loeffler from Facebook. When will senior living and assisted living in the Chicago city limits be more accessible to family members to visit relatives?
Okay.
That's
Yeah, we haven't talked about that too much. So the city of Chicago actually does not set any of the requirements around visiting for senior living or skilled nursing facilities. There are requirements that are set, depending a little bit on the setting, first of all by CMS, Center for Medicaid, Medicare, that funds a lot of the people who stay there, but then also the state that regulates long-term care facilities does set some requirements. And so if you're interested, if you look, the Illinois Department of Public Health has a lot of detail up about sort of visitation requirements and recommendations. But at a very high level, there actually has been already a lot of relaxation of visitation requirements, mainly because the vaccine is here. So if 70% of the residents in one of these settings is vaccinated, as long as they're not having an outbreak or sort of known to be having COVID, broadly speaking, people are absolutely now able to come in. There is still a mask requirement. I don't see that going away anytime soon, given that we still know that folks in these settings remain very high risk. Mm-hmm. But more than half of our nursing homes have now gone a month or more without a case because we've seen pretty good vaccine uptake in those settings. It really is where you look at the comparison of where we were. So I think if I don't know if this is a personal question someone has, if you call the personal the place where your loved one is, they'll be able to give you the up-to-date guidance. But broadly, where there are restrictions, it's usually because there have been recent COVID cases or transmission, and more, there has been a lot of opening, just still with some caution. You obviously can't go in if, like, even me with these symptoms, I shouldn't be in a setting like that. Still some caution there, but broadly with vaccines, and there are some long-term care facilities here that are like 100% vaccinated, which is just amazing. There's just very little concern for COVID then in those settings. So really shout out to those that have gotten everybody vaccinated.
Yeah, it's making me think about those images of people coming to give hugs through
and like through the
plastic
windows and touching. Yeah. Exactly. So
nice to be turning that corner.
Yep.
Here's a question from @Denise Skiana from Twitter. When are we considered out of the emergency use only phase? It seems to me that there are plenty of other states wide open and doing fantastic. Healthy children have no reason to be part of this experiment. Stop trying to sell it.
Okay, so there's a lot in there. Actually, the different parts of that question are not all related to each other. So the first part of the question was, why are we in the emergency use phase? Is that right?
EUA?
Yeah, exactly. So let's talk about that. The emergency use authorization phase is in no way linked to reopening or to children. The emergency use authorization is what the vaccines have been approved under by the FDA. And let's talk about that for a second, because it's a good question. So typically, when any drug or any vaccine wants to be, has finished all of the trials, all of the scientific work that needs to be done, they've proven that their product is safe and effective, they submit to the FDA all of the data, and they ask for their drug or their vaccine to be approved. That process of approval typically takes years. And because the FDA is looking through every bit of the data, there's a lot of extra work. There's work that they go and they visit all of the plants that produce the drug or the vaccine, just all kinds of quality checks. And it really is often a multi-year process. So emergency use authorization is meant in a public health emergency. You might want to speed that process up, not by skipping any of the scientific steps, but some of the sort of bureaucratic authorization practices. And the big difference is that under the emergency use authorization, you have to submit, a certain amount of follow-up time, but you might not have the full 6 months of follow-up time. And so now Pfizer actually has completed more than 6 months of follow-up on everybody who got the vaccine. They did not see any more troubles related to side effects. They didn't see problems with fertility. They didn't see problems with pregnancy. They didn't see problems with efficacy. The vaccine remained very, very protective, which was important. The antibody levels stayed up. They were basically as good at 6 months as they had been at the beginning. And so once there was more than 6 months, they could submit all of that data. And so it was just a week or two ago that they submitted all of that data for the full approval from the FDA. Moderna has signaled they're just probably a couple of weeks behind here, as they've been all along. So we would expect that to be submitted. But it's still going to take, even if the FDA is moving quickly, I expect it will probably still take maybe 3 months, if I had to take a guess, for that full approval to come through. And then when a drug or a vaccine is fully approved, it means that we don't have to be under an emergency to use it, right? Under the emergency use authorization, it's partly that there is a public health emergency. And so if we were not under the public health emergency, you wouldn't use a drug under emergency use authorization. So that way it will be available even when we come out of the emergency. And it means that actually, like right now, you're not allowed to directly market the vaccine, actually. You have to have full approval for the company to be able to be directly sharing information. So there's just a number of things that come along with it. But I absolutely expect that we will get the full approval there. But that emergency use authorization has nothing to do with reopening. And in fact, we have been, moving, we've got these really nice numbers here because, when we did a reopening, 2 weeks ago, and it looked good, and things are certainly, continuing to look very good there. And so I am confident, that things keep continuing in the way they're going and people keep getting vaccinated. Absolutely, we're going to be able to be open here, which is exciting. But we need folks to keep getting vaccinated to really be able to put this behind us. And then the last part of the question was something about experimental for children.
Healthy children have no reason to be part of this experiment. Stop trying to sell it. What's interesting is that children were part of the trials, and that's why we're able to offer up Pfizer to 12 plus.
Yes,
right?
That's exactly right, and that's what I would say. I mean, in terms of the sort of experiment, sometimes experiment, people think that's like a dirty word or a bad word. It's not an experiment, it's a trial to see whether the vaccine works. And so just as was done for adults, the same level of scrutiny has been done for the trials for children. More than 2,000 kids, adolescents, for example, in the Pfizer trial, half of the kids got the real COVID vaccine, half of the kids got a dummy injection. They didn't know which one they got. The doctors didn't know which one they got. They follow everybody forward. They look for side effects. They look for the antibody levels, and then they look to see, are they protected from COVID? And so in the trial, in the group that got the COVID vaccine, 0 kids got COVID, actually. And in the group that had got the dummy vaccine, 16 kids got COVID. So the protection level was very good. And then actually when they checked the antibody levels, the protection level was even a little better for the kids than it was for the young adults. And no concerns for long-term or serious side effects, obviously. So that's why the FDA and then the ACIP gave it the green light to go ahead. So I have been, just to be really clear on this, the same level of scrutiny for kids. In fact, a higher level of scrutiny for kids. It's why we start with adults and then move ahead with children. And I absolutely recommend this vaccine for really any child over the age of 12. That is the recommendation I've given to my own friends and family. I've had a lot of people already this morning texting me pictures of their kids getting their first vaccines. And it really is, it's exciting. It's not an experiment. It's an ability to protect your kids and your family and your community, because we know children are less likely to get severe COVID. They're certainly much less likely to be hospitalized or die, thank goodness. But we know especially older children can spread COVID. And where we think about wanting to get past COVID as a society, it is really important that kids are also part of the, of the vaccination picture.
Yeah, my daughter's getting her second shot today.
Excellent.
And we talked a little bit about the camp that she goes to
Yeah.
every summer.
Yeah.
And how she didn't get to go last summer. And, you know, I
Right.
don't know if she'll get to go this summer, but it was just nice to think about, you know, the fact that it could be possible.
Yeah.
So,
How old's your daughter?
16.
Yep. So she could already get that first one. So,
Yes, that's
yeah.
why she already had the first one.
Exactly,
Yes.
exactly.
That's
But
why
it's,
the
you know,
second-
but I think there, you know, with so much openness, you know, camps and pools and
Yeah.
like it's I'm really pleased that this vaccine is available for this age group.
And as a parent, to be able to send your kid someplace and feel that they're going to be safe.
Right.
So big relief. All right, Elizabeth Santiago, here's a question from a parent. Son has 5 different ailments, which include double antibody and antiphospholipid.
Yep.
Is it wise to take vaccine even with lupus, kidney failure? Mom is not vaccinated yet, and she will be caregiver for dialysis.
Okay, so a lot going on there.
Layers.
Yeah, and you know, first, you know, I'm not sure who's writing in that question, if that's mom or another caregiver, but you know, certainly it sounds like was it a son?
Son.
You know, your son has a lot of underlying conditions. You know, always I encourage people to talk to your doctor, and that's what I would encourage here too. But I will say very broadly that it is exactly children who have these kinds of underlying conditions. If they're needing to be on dialysis, if they have some of these antiphospholipid and other syndromes, these are the kids at the really higher risk for severe outcomes from COVID. And so these are exactly the kids that I would be the most concerned about if they got COVID, and therefore the kids that I would most strongly be recommending vaccine for. So what I've been encouraging everybody, you know, if you've got a question about, you know, my condition and a COVID vaccine, talk to your doctor, you know, and basically ask them, you know, is my risk higher if I get COVID or if I get the COVID vaccine, in terms of in terms of that. So, and then the other thing is, I would really, if mom is a caregiver for someone on dialysis, or really anyone who's a caregiver for someone on dialysis, it is pretty important that mom herself get vaccinated. When people are caregivers for folks with underlying conditions, you know, some of this is about protecting yourself, but it's also about protecting others. So again, I would encourage that whole family to have the conversation, you know, at dialysis. We've actually worked, and so has the federal government, to make vaccine available through dialysis centers,
Yes.
given we know what a high risk people have for bad outcomes if they have kidney failure. So yeah, thanks for the question, and I would definitely encourage vaccine in that setting.
Yeah, and that's also a reason why the Homebound program
Yes.
includes the caregivers who live
Yes.
with the person who might
Excellent
be homebound.
point. Yep.
Sarah H., did the time I have to wait between my other immunizations in the... is the time that I have to wait between my other immunizations in the COVID vaccine same for kids as
Okay.
it is for adults?
Okay, yeah, good. So yesterday, you know, the big news out of ACIP was the Advisory Committee on Immunization Practices was that they approved vaccine for children. But the other piece that didn't get as much attention, but which I was very excited about, is they actually, having looked at all of the data, they removed that requirement or that recommendation that you space the COVID vaccine at least 2 weeks separate from other vaccines. And we've talked about this a fair bit on here,
Yes.
where people have said, I got my shingles vaccine or I got my HPV vaccine. Should I wait? How long should I wait? So having looked at all of the data, they removed the recommendation that the COVID vaccine needs to be spaced out. I think that was a good decision based on what I've seen.
And that's for kids and adults.
Kids and adults, that's right. And so the good news there is that, and you know, this has to do with not seeing interactions between vaccines, et cetera. Especially for kids, this was something I was really interested in because there are more, you know, childhood vaccines and adolescent vaccines, and we know that it can be hard for families to have to come in multiple times to make sure you're caught up. And for this last year and a half, we know that people have gotten behind on some of their vaccines, kids and adults. And so the ability, you know, if you've got your kid who's going away to college in the fall, come in, get your COVID vaccine and your meningitis vaccine at the same time and be done with it is going to be really helpful. Similarly, for adults too. No longer are they recommending the need to space between vaccines. If you have questions, ask your doctor. But that was a change, and I think a very good change from the ACIP.
Got it. All right. We have a few minutes left. Here's a question from Arlene Stokes from Facebook. If I'm on an antibiotic, can I still get my Pfizer vaccine?
You can. So antibiotics are to treat bacterial infections, meaning an infection that is caused by a bacteria. So you might be on an antibiotic for, you will be on an antibiotic for an infection of some kind, typically caused by a bacteria. Everything related to COVID is about viruses. So the antibiotic does not in any way impact the virus. It does not interfere with the COVID vaccine, which is protecting against a virus. Obviously, if you're not feeling well or if your doctor recommends that you wait, you should do that. But there's no biological reason why you cannot get the COVID vaccine if you're needing to take an antibiotic at the same time.
All right. Here's a good one to end on. From Mary Beth Nolan from Facebook. Do vaccines mean a person can't get COVID-19, or do they protect a person from a serious case that might mean hospitalization? Thank you.
Yeah, that is a good question. So these vaccines are about as good as vaccines get when we talk about really protecting people from COVID, particularly that Pfizer and Moderna, they are about 94, 95% protective after the second dose, 2 weeks after the second dose from those vaccines. And so a vaccine that's 95% protective is pretty amazing. It does still mean, though, that there's a 5% chance or a 1 in 20 chance that if you were exposed to COVID, you could still potentially get COVID. And that's called a breakthrough case. We have seen some breakthrough cases here, and we've seen a few. We looked at this data, I think, last week. I think we'd had, at that point, fewer than 50 people who had been hospitalized, more severely. Most people who have been diagnosed with a breakthrough case actually have not had symptoms at all. They're tested because they want to travel, or they're in a high-risk setting and they're being tested frequently at work, et cetera. But it's certainly something we've been looking at a lot, and then we do some testing. We talked about this last week. We do some testing to see, was this a variant? Was this a reinfection? So that we can understand, are there concerns where there's a breakthrough infection? But the most important thing that these vaccines do is be highly protective against those severe outcomes, against the hospitalization and the death. They're still not 100% protective. Nothing is 100% protective. But, where we look at the, more than 2 million vaccines here that have already been given in Chicago, more than 260 million around the US, more than 1.3 billion around the world. The data is very clear that these vaccines are so effective in terms of really helping protect all three of the available vaccines. Very, very protective, especially against hospitalization and death. Still not 100%. And that's where getting everybody ideally vaccinated, right? That's how we build up. If in your social network virtually everybody has been vaccinated, you're not going to have a lot of risk for being exposed to COVID, and your risk is low. But if you're in a setting where very few people around you are vaccinated, and there's a lot of COVID, that vaccine is the most important thing you can do to protect yourself. But there is still some risk of those around you. So the main thing that it does is be protective against the severe outcomes, but conveniently it's also protective against COVID broadly. The other last thing on that is that they also, there's been a lot of science, particularly Israel, that is the most vaccinated country. They were really able to show that as vaccine was rolling out, you could see the indirect effects in terms of there being protection across the population, and able to find that if people are diagnosed with COVID, one of these breakthrough infections, their level of virus is actually much, much, much lower. And so the thought is it's very hard for them to then transmit virus, even if they were infected with that. And we've seen that broadly here in Chicago, where we've had a breakthrough case. We do a lot of extra follow-up there to understand what was going on there. And we really have not seen, even in some of the long-term care facilities where there's the most testing going on, high risk, we did not see, and we published this a few weeks ago, we did not see examples of spread of any of COVID, even where we were seeing a breakthrough case. So yeah, it's interesting. We're still really learning about that, but all the news continues to be good, really. I'm just so grateful to have a vaccine that is so safe and so effective, and it's making a huge difference in the settings where we see good uptake.
All right. How about some good news, Doc?
All right. So I really liked this announcement from the Department of Transportation. Now that people are starting to emerge a little bit more, if you never learned to ride a bike, they have a Learn to Ride program, free bike riding classes for adults. So classes start June 1st, and it's CDOT, the Department of Transportation. They have these ambassadors, Streets Are for Everybody ambassadors, and so they're free. They're for anybody who live in Chicago. If you want to learn how to ride, or you just want a refresher, you haven't been on there in a while, and they're going to be having them in a few different locations. So chicago.gov/CDOT is where you can go. And I just thought it was kind of fun, right? Like one of my friends learned to swim not too long ago, and I love it like when adults take on the, like, let's learn something that maybe a lot of people learned as a kid. So you know, we encourage folks, obviously, you know, to be using active transportation, walking and biking with that helmet. But I just thought that was kind of a cool, good news thing for summer. And then I think just one more, you know, we saw hundreds of folks signing up for that vaccine ambassador course, really just in the first 24
great.
hours. Yep. It's through Malcolm X in English and Spanish. Again, free, takes 2 hours. I would love it if you guys took a look at that. ccc.edu/vaccine ambassador, and give us some feedback. Let us know, because it's where we're looking ahead to this summer. People listen to their doctor, first and foremost, about vaccine. Number two, they listen to friends and family. So where you have good information and are talking, you know, if you're someone who's been vaccinated, having that conversation.
It's a great resource, right? When people are
It
trying
is.
to figure out how to have the conversation and
Yeah.
what they could say, and
Yeah.
just having information and facts that
Exactly.
can be helpful.
Yeah, so I would encourage you to check that out, because we're sort of excited about having a new resource. You do get a certificate at the end of that course as well. So that's been
And a
nice.
lovely collaboration.
Yeah, it is.
Yeah.
Yeah. City Colleges has just been great. They, you know, so many of our mass vaccination sites have been through City Colleges. They've partnered with us throughout in terms of helping do a lot of the continuing education and the Earn as You Learn for our contact tracers. And Malcolm X obviously is the City College that's focused on health and health sciences, and really very appreciative for all the ways that they've kind of stepped up for Chicago in COVID.
Played a big role
They
during
have.
this pandemic.
Yep.
So hats off to Chancellor Salgado and his whole team there at
Absolutely.
City Colleges. All right, well,
All right.
we're done for today. We're
We
back
are.
on Tuesday.
We're back on Tuesday. Please, let's keep getting vaccinated. You know, that's really where
Don't
we're
give
at.
COVID an opportunity.
There you
right?
go. I like that.
Yeah. All right. Protect Chicago by protecting yourself, your family, your community, and keep up the good work.
We'll be back next Tuesday at 11. Thanks.